Good morning. I wasn't sure if it was morning or afternoon. It's still morning. It's around 9:30 on Sunday. Good morning. This is Dr. McDaniel at GYN Corner. As I said, it's Sunday. It's a really sunny Sunday, but unfortunately it's kind of windy, so it's a little bit chill outside today. Sunday, June 9th. And let's see, as the title indicated, I'm speaking on postmenopausal bleeding, or bleeding after menopause, which is postmenopausal bleeding. I thought about this. I had a patient last week who came in with postmenopausal bleeding. So menopause is defined as any woman who is no longer menstruating for at least 12 months in the face of menopausal symptoms, primarily hot flushes, night sweats, or lots of PMS, premenstrual symptoms that are throughout the month, and or has had her blood drawn for hormone levels, and the lack of a menstrual cycle is not due to medical problems. It's because her ovarian hormones and brain hormones are indicating that she's no longer fertile due to age. So most women go through menopause between 52 and 54, but perfectly normal is considered any time after 43 years old. So bleeding after menopause is any bleeding after someone has been, I don't want to say diagnosed, but has been confirmed to be in a menopausal state. Now, to me it seems obvious, but apparently it's not obvious. To me, it's obvious that you should not bleed once you've gone through menopause. But I have had patients who thought it was okay to bleed after they'd gone through menopause. They thought that sometimes some women's menstrual cycles or their periods returned. I remember distinctly I had a patient a couple of years ago who said, her grandmother told her to always keep a pack of sanitary pads in her bathroom because sometimes the periods come back. Well, it is true, sometimes the periods come back, but it's not normal. They're not really periods. It's abnormal bleeding after menopause, or what we call post-menopausal bleeding. It's not normal, and it needs to always be evaluated, regardless of whether it's lots of bleeding like a period, or if it's just, sorry, bad allergies today. Regardless of whether it's lots of bleeding like a period, or if it's just brown, smudgy, or pink, spotty, blood is blood is blood. Everyone knows what blood looks like. If it looks like you're seeing something that is consistent with blood, be it a teeny bit, a lot, a little, or somewhere in between, it's not normal if you've been confirmed as menopausal. The evaluation for menopausal bleeding is pretty simple. We will examine you to see if the bleeding could potentially have come from the lower genital tract, and that means from the labia, the vagina, or the cervix. So some women will say that they're bleeding, but then when you take a look, they have some tears or some abrasions around the vaginal opening or in the vaginal canal, and it's due to intercourse or some kind of sexual activity that caused bleeding from the labia and from the vagina. So that's not really considered postmenopausal bleeding, because postmenopausal bleeding is bleeding from the uterus, not from the lower genital tract. The uterus is considered the upper genital tract because it's in the body. So we'll take a look. We'll look to see if there's any tears or abrasions or blisters. Sometimes people come in and say they've had bleeding, they've gone through menopause, but when I take a look, they didn't realize it, but it was a herpes outbreak. They have a lot of little ulcers, or they have 2 or 3 ulcers that popped and those were bleeding, or they have fissures, which are little cracks in the skin due to inflammatory changes, infection, or an irritant, or the bleeding could be coming from what we call external hemorrhoids. So the bleeding could be coming from the anal area, but they thought after they wiped with toilet paper, they thought it was coming from the vaginal region, or they weren't sure. So we'll take a look. Every once in a while, the bleeding's coming from higher up in the vagina. The vaginal tissues get very thin and dried out and fragile. We call that vaginal atrophy. And when they're dried out, they will often bleed with any kind of activity, sexual activity or otherwise, and sometimes they will bleed on their own. They just get thin and dry, and the little tiny capillaries underneath the skin layer, they start spasming or they bleed. And then I've actually seen, I've seen a couple of patients over the years who the tissue has gotten so thin and dried out for no reason other than menopause, where they had large ulcerated areas on the vagina. Now, for large ulcerated areas, I always have to sample those areas to confirm that they're not due to cancerous changes or malignant changes. So I'll do a pap smear of the area with the brush, scrub that area really well. If it's confirms that there is cancer, then that's the diagnosis right there. I'll usually add a biopsy. If it doesn't confirm, then I'll always do a biopsy. If it just says inflamed cells or atypical cells, then I'll take a sample of the skin from that area, send it to the pathology lab to confirm that we're not dealing with bleeding due to carcinoma or cancer, malignant changes. Oftentimes the bleeding's just because the vaginal tissues have not seen estrogen, so they've gotten very, very thin, dried out, and they've ulcerated because they're so dry and non-supple. And in that case, I'll describe later, we just give a treatment to revitalize the tissues. And then occasionally it will be from cancerous changes, vaginal cancer. Also look at the cervix. Sometimes there are polyps or abnormal balls of blood vessels that are present, and the polyps can be the reason for the bleeding because they can bleed without any provocation. If everything looks normal on the physical examination, there's no obvious reason why the patient saw bleeding, then we'll do additional evaluation. I'll go into that additional evaluation tomorrow. I don't want this to be very long. I saw yesterday's presentation was almost 20 minutes, 15 minutes or so. So I'm trying to keep these short and sweet. So tomorrow I'll be back with postmenopausal bleeding or bleeding after menopause, which is not normal. It does happen, but one should never consider that it's normal to see periods again or to see any kind of bleeding or anniversary period if it's been a year or more without cycles and you've been diagnosed or confirmed to have a menopausal status. So I hope that's been helpful. This is Dr. McDaniel at GYN Corner. I'm going to break down and dye my hair today. I hate dyeing my hair. It's just such a pain. I have to do 2 dyes. I have to dye it blonde just to lighten the black and gray hair up. And then I have to dye it red once it's dyed blonde. I usually dye my whole hair for like a long time, like 5 hours. I let the dye sit on. But I noticed some of the hair at the base was getting a little thin. So I think it's permanent dye. I think the dye is just, I'm out of control with how long I'm leaving it on, trying to get bright red hair. I like bright red hair, crazy hair. So today I'm going to dye the roots blonde to get rid of the black and gray, the salt and pepper, which in my opinion looks horrible, but I had to try to let it grow out a bit more than usual. I usually dye my hair every 3 months, and I just had to give it more time to heal. So I'm going to dye the roots blonde, and then unfortunately, God, look at all that gray. It looks horrible. This has been about, golly, it's been about 3 months. It's been like, well, last time I dyed it, it hasn't even been 3 months. That's horrible. It hasn't been 3 months. I just realized. I think I dyed it a little bit before Easter. I told you to play. I think I dyed it a little bit before Easter, so it's been about I think it's been about 3 months, but that's a lot of new growth. So maybe I dyed it before March, before St. Patty's Day. It's been about 3 months, and I really I gotta dye it blonde, and then I have to dye it red. So I'm gonna do that today. Unfortunately, that's always a painful process. It takes a few hours, and then I'm not gonna dye the ends. I'm gonna maybe let the dye on them for 10 minutes just to brighten it a teensy bit, and then I'm gonna try to just put it on the new growth maybe an hour. So usually it's like a 6-hour process. I'm gonna try to shrink down. God, look at all that gray. I look like an old lady, but I'm over 50. So I'm gonna put the dye on for just maybe an hour today, just to get it bright as much as possible within an hour. Alright, so that's gonna be my morning, and then I have to drive my girls around to do a bit of shopping again today. You guys have a great rest of the Sunday. We'll be back on Monday. I'll show my roots if anybody cares tomorrow. Transformation. I hope it looks decent. Have a great day. Thank you for joining, and I'll be back tomorrow on more postmenopausal bleeding. Bye.